I'm Gillian Green, and I'm a 2-year survivor of stage 3 breast cancer.
My name is Jan, and I have invasive ductal carcinoma breast cancer.
My name is Katie. I am now 33 years old. I was diagnosed with breast cancer at 29 years of age.
Earlier on in my life, I'd had breast implants, and I suddenly found a lump, and I decided that that was scar tissue that was growing around the implant.
Performed a self-breast exam and found a lump.
I was doing self-exams every month, and I felt, I think it was in August, the early August, I felt like it was pea-sized in my left breast. And then a month later, like the end of August, I checked again and it felt about the size of a marble. So I knew something was out of whack.
It was very surreal when I found out that what I had thought had just been a cyst was actually breast cancer, and it was hard to imagine that something had been kind of growing inside me for almost a year.
I read it online and I checked up, and I knew that scar tissue could happen, so I chose to ignore it.
I had no symptoms. I mean, I felt great. I just got back from vacation from Florida. I was tan, I was slim, I was about to start work as a nurse.
But it didn't register for a long time that it was actually cancer. And even meeting with oncologists and radiologists and even receiving chemo, it took me a while to really register I have cancer. It was hard to even say the words.
I saved up enough money, and I went back to my plastic surgeon to get my implants revised. And when I stood there all happy saying, oh, it's time to change them out, and I have this scar tissue and we need to get it fixed. And then he took one look at me and said, Jill, that's not scar tissue. And that was almost like the ground just opened up and swallowed me.
When I first got diagnosed, I was in Walmart, and I just went into shock. And I honestly thought I'm gonna die.
The hardest part of my diagnosis and treatment has been losing control. As someone who's always been very organized and very in control of my life and kind of one of those type A personalities, all of a sudden when you receive this news, you realize you have control over very little in your life.
I never thought I was never sick. I never had been sick. And then all of a sudden I realized that I knew of all the treatments that I'd have to go through, and suddenly it's like having your mortality challenged. You never think that something's going to come along at 46 that would threaten your life.
Check yourself once a month at least. If you haven't had a mammogram in a year, call your doctor and set that up. Go for yearly physicals and be in tune with your body.
Because education is so important, and I think more women, especially women in their 20s and their 30s, need to be educated on breast cancer.
So early detection for breast cancer is probably the most important thing for a woman, because she'll be able to treat it earlier and get a better prognosis. The treatment will also be hopefully less invasive and less difficult for her. Women can reduce their risk for breast cancer by being vigilant about their breast health. That means doing monthly breast exams, also going to the doctor at a regular basis, and getting their mammograms. I usually recommend that my patients get a mammogram as a baseline at 35 and then at 40 and every year thereafter. Of course, if they have a family history of breast cancer, they should start screening a little bit earlier. Usually we say start 10 years before your mom or your aunt or your sister was diagnosed.
For women who have not been diagnosed, who think it can never happen to them, well, that was a nice world to live in before I found out. Don't think it can't happen to you. It's going to happen to 1 in 8 women. Look around you. Nobody knows who that's going to be. Go get yourself checked. Go get your mammogram, or check yourself monthly. And anything that you find, you go and see a physician.
What I would say to young women is, look at me. I mean, I'm 33 now, but I was 29 when I was diagnosed. And it's scary, when you're in your 20s, you think, oh, I'm going to live forever, I'm going to look like this forever, I'm going to be so healthy. And you don't know what life can throw at you. Absolutely check your breasts every day. And I know it's scary to think I got to go to the doctor and he might tell me this or that, but it could be so much worse if you hold it off.
I'm Jan, and I'm a soldier in the Pink Army.
My name is Katie, and I am a soldier in the Pink Army.
My name is Jill, and I'm a soldier in the Pink Army.